Welcome to this episode of Brilliant Brains and Beautiful Minds. I'm your host, Melanie Bernicle. Today we're chatting with one of Australia's leading facelift plastic surgeons. Please welcome my guest, Jack Zoumaras.
Thanks for having me, Melanie.
Thanks for joining us, Jack. Now, you are one of Australia's top plastic surgeons, so I'm very grateful to you sparing the time today. How have you, like obviously at the moment, you're still on restraints with surgery?
Yeah, there's still restrictions. So we never closed our office at all. So we've been open 9 to 5 throughout, and
Yep,
we've been doing most consultations virtually via video.
yep.
Over the last week, we've started seeing patients face to face, and this week we're doing 50-50 and in full
Aha.
transition to face next week. Of course, with all WHO Australian guidelines with sanitization and things like, which we were
Yep.
doing anyway, being a
Yeah.
medical. Um, but with this surgical space, yeah, we're not sure yet. The Prime Minister said on Friday they're going from 50 to 75 to 100% allowance for elective surgery. So we're just going to wait to see what New South Wales do. I envisage June, end of June, we should be able to do most plastic surgery things.
That's very exciting.
Yeah, exciting.
Winter's always a good time to get some things done.
Probably the best time. That's right.
Don't worry, I've looked into it. So just sort of let's go back a little bit and let's talk about your career evolution. When you were younger, did you see yourself in being a doctor, a plastic surgeon, or where did you see yourself headed?
Yeah, no, I was one of the ones that always wanted to be a doctor. So when I was from age 4 or 5, I wanted to be a doctor. So uh, I didn't choose plastic surgery down the track, but yeah, when I was younger, partly was because I had a sister that was older than me that had an intellectual disability,
Yep.
and we were often at doctor's appointments with my parents. And I liked the way doctors just reassured us and things like that. When I went to the
Yeah.
doctor, I kind of liked the reassurance. And I remember vividly once when I probably an immunization, and I was so annoyed. And I said to the doctor, "One day I'm going to become a doctor and I'm going to inject you." I've always wanted to be a doctor from a young age. I used to play in my front veranda, pretending I'm going to my clinic, going home. So yeah,
Wow, so you just saw it, made it happen, which never happens that easily. Like, how many years did you study to be where you're at?
yeah. So after high school, I did 4 years of undergraduate, so 3 years plus an honors research degree. Then I did a 1 year break, and then I did 4 years of medicine. So 9 years after high school, and then I've done another 9 years before becoming a plastic surgeon.
Wow.
Too long, too long.
Yeah, but I think if if someone was to go under the knife, at least somebody has an amazing set of skills that you
Yeah,
feel
absolutely. Yeah.
you're going to
Well,
come out better the other end.
yeah, 100%.
And then, so when you have traveled and worked overseas as well, can you tell us a little bit about that? And is that what led you more into the face side of plastic surgery, or?
Yeah, yeah, I'd say probably, yeah. Like part of the reason why face is the most challenging. It's considered the doyen of plastic surgery. And that's what kind of drew me to it. I wanted like the challenge of the responsibility of working on someone's face because you can't hide it.
Yep.
So you have to do it well. But yeah, you're right. So in final year medical school, I went to New York doing an elective in plastic surgery, and a lot of the guys in New York were doing facelifts and facial plastic surgery, and I kind of was excited and drawn to that. So
Yep.
that's kind of why I pushed myself towards face, and as you said, and wanted to do face plastic surgery from an intern that early, even before I started doing surgery. So I've always wanted to do that, and believe it or not, a lot of my colleagues, even to this day, believe it or not, are like, oh no, you shouldn't be doing face. You should only be doing a facelift when you're old enough to have one yourself or a lot older, which is just, it's just typical medical bureaucracy and conservatism, really.
Yeah, I think that sort of happens, I guess, in most industries, but it's nice to go, you know what, I've got the skill.
Yeah,
Like, I'm not waiting. Like, if I've got it, just let me
yeah,
do it.
yeah, exactly.
Have you had that attitude, I guess, from when you're a kid? I think by the sounds of it, you like a challenge, you want to win and you want to be the best. So it's like, well, here I am.
Yeah, yeah, no, it's been like that, and that's the thing. I've only ever considered medicine as a career, and then once I decided on plastic surgery, I kind of didn't really consider anything else. So
Yeah.
almost like just focused, going for it. Yeah,
You are seeing something that's not there
yeah.
and being able to create that. Would you say that you're more, I guess, analytical or creative or somewhere
Yeah, look, it's interesting you say that. I think you have to kind of be a bit of both in plastic surgery, especially when you're doing the face and you're sculpting a nose or the fat or the face or the eye. So you're absolutely right. You kind of have to visualize what's not there yet or what you could do,
Yeah.
especially when you're doing a nose or an eye if you're reshaping it. Often
Mm.
anti-aging surgeries, you're restoring something that was there already. Like patients will show photos of what they looked like 10 years ago, or they'll demonstrate what they want. Whereas it's hard to demonstrate what you want with a nose or an eye. You just get inspirational photos. So part of it is visualizing what's possible and then to see if you can actually make it happen. Because sometimes you might not be able to. Like, for example, I get many patients of Mediterranean descent that want a Nicole Kidman nose, and it's just impossible. I mean, the skin quality is different, the texturing's different, the structure's different. You can get it close, but you just can't do it. So
Yeah, I guess that comes to one of the questions I had in mind, which was the consultation that you have with someone before doing a surgery. That communication must be so important. Do you find people's expectations can be quite unrealistic, and how do you manage that to be
yeah.
really honest with them?
Yeah, you just exactly as you said, you just got to be honest. Like, there's one thing, maybe not having the skill to do something, but then there's another thing of you just not, it's not possible to do. So you just got to make sure you identify that in your own skill set that you can do it. And then if you can do it, is what you're going to do what the patient wants as well. So you got to be
Yeah,
on the same, they got to be on the same page. So, and that's why the consultation, the first time I meet someone for facial surgery, it's up to an hour, sometimes longer, depending on how many questions they have. And then we
yeah,
always do a follow up before we do surgery. And often, once we book a surgery date, I see them once before. So a lot of the times, I see someone 3 times before doing the surgery. Um,
wow,
and the first time, obviously, it's almost information overload.
yeah,
You have to go through things. We're going to go through the creative things of what's possible, but also the actual logistical medical things like downtime, potential risks. So it's if there's a lot you have to cover. So we often need another consultation and sometimes a third.
yeah. Do you find, like, I know when I get excited about something,
Yeah,
sometimes you're only hearing the information that you want to receive and you're
yeah,
missing it. Do
100%.
people, would people like bring a buddy to a consultation so that someone else is absorbing, or how does it work?
Everybody's different. I have some patients that come completely on their own. Some patients come with a buddy, but they don't want the buddy to come into the consulting room, but they
Yep.
come to them for moral support to the clinic. And then others bring more than one. They bring like 3 people with them. So you're absolutely right. And that's why we do a second consultation, because sometimes you're only listening to what you want. So a lot of the time is, they're visualizing what they want done to their nose or their face, and they're not listening to the fact that they're going to have bruising, or there's going to be downtime, or there's a 1% chance that we might need to do revision surgery in the first 24 hours because there might be some bleeding or something. So that's why we try and demonstrate, or not demonstrate, but go over the consultation process many times by having more than one consult. We also provide written information as well to take home, so that way they can at least read what I've given them.
Yep.
And we always make a follow-up appointment for them, so then they've
Yeah.
got chances to ask more questions.
Yeah, I think that would be really, really key, because I know if I'm really excited or if I'm really scared, it's like I think I take in probably about half of the information.
Yeah.
Yeah. Would you consider like somebody's mental health in a consultation as well? Is there stuff that comes up to make sure people are doing things? I guess everyone's going to have their own reasons for wanting a surgery, but is that something that you would consider?
Yeah, 100%. And it's something you have to consider as a plastic surgeon. I think, unfortunately, in society, up to 20% have some sort of depression or anxiety in a time of their life, and that can influence the reason why they're having surgery. Body dysmorphia also comes up in plastic surgery. It's in probably about 10% of the population, which is still quite high.
Mm.
But of those, patients with body dysmorphia will seek a plastic surgeon almost up to 50% of the time. So you have to be aware of those things. But it comes down to having a rapport, and actually asking questions. Like, you just got to ask, why do you want your nose surgery? Why do you want a facelift? Or why do you want a breast augmentation? A lot of the time it's like, you just got to ask the reasons why, because I think they're just as important. As an example, I've had a patient that wanted to have breast implants after breaking up with her boyfriend, because the boyfriend, and I turned her away and I said, no, maybe just think about it a bit longer and before going ahead and doing it, because the reason they were doing it in that frame of mind was because something that had happened emotionally,
Yeah.
not, and they didn't really want to do it.
There was like a trigger point in thinking, oh,
Yeah,
maybe if I had done that, maybe this would
yeah,
still work.
exactly. And
Or
obviously, it's not the reason. The reason is not. It's multitude. It's not the implant.
yeah,
Whilst the implant might be relevant down the track or whatever, it's not right now.
yeah,
The other thing is, you just got to, screening questions in terms of if they've got a realistic expectation, if they've had multiple plastic surgery or been for other opinions. I've given a lecture on body dysmorphia at Cosmeticon this year to identify those things. And
yeah,
sometimes you do miss things. And that's why it's important to do follow-up consultations, because there are some red flags that come up that you can identify.
yeah,
And it's important. And I was part of a task force about 2 years ago now about trying to uncover those sort of things. And it's not to say that if there's some psychology involved, you can't have plastic surgery. So I've had psychologists refer me people to have plastic surgery because it will be beneficial for their their mental health. So
yeah,
it's not, and so we just got to recognize what it is, and if necessary, be open and have a relationship with the patient that you can say, hey, Mel, look, I'm happy to do your operation, but look, I think you should maybe see this person first, just to
yeah,
discuss the reasons for it, and then we'll do it.
yeah,
Yeah.
yeah. I think it's really important. I think like for me, like I've had a couple of things done, like with my pigmentation, and it was something that really bothered me. And
Yeah.
other people are like, oh, I don't notice it. I'm like, I don't care if you notice it.
Yeah, it's
It's
for you.
something that was me. And look, it's not 100% perfect, but I'm happy
Yeah.
with where it's at in comparison. And so it's something that I wanted to make me feel better. And it's not that I didn't see myself as beautiful, and it's not that I don't love myself. I'm quite happy with the human I am. But that for me was just something that I started covering heavier with makeup, and then I was starting to look older, and I'm like, ah. And so I thought, no, this is something I want to do for me. And I did the full on laser,
Yeah.
on my face. And, I think it's so important that you do things for you if that's what feels right.
Yeah. Yeah. I couldn't agree more. I mean, plastic surgery is a personal choice.
Yeah.
And unfortunately in society, and it's not just now, people always judge people.
Mm,
And a lot of my patients, and they feel sometimes alone in the plastic surgery journey because they can't even tell their best friend or their girlfriend, because if you get judged, it's like, oh, you don't need your nose done, or you don't need this, and
mm,
they just don't understand it from their patient's point of view. And a lot of people are nice as well. Some people might have an obvious nose that's, way too large for their face. And people are like, oh, you don't need your nose done. And it's like, well, it's a personal choice that person has to do, It's
yeah.
it's also like children. Like, for example, it happens in kids as well. Like some young girls don't wear their hair up because they've got prominent ears at school.
Yeah.
And I don't want to get teased. And often I do 5 to 7-year-olds before that teasing age, I guess,
Yeah.
in their ears back. So, it's not always about like pure cosmetic surgery. It's just little things that you want to
Yeah.
repair on your face, just to kind of, I guess, blend in or to society. And it's a personal choice. Like no one can understand it except you.
Yeah. Do you find that people still really are shying away from being open about any surgery?
Yeah, look, in the sort of work that I do on the face, definitely 100%. Like probably every single one of my facelift patients, except for probably 5% of them, don't want anyone else to know they've had a facelift.
Wow.
Sometimes it's not even their sister. Sometimes they're happy with their own family to know, but no one else.
Yep.
It's just, it really is still taboo. Like with rhinoplasty surgery, it really depends. I'd say it's 50-50. A lot of the time they're happy to talk about it. And some patients would send me photos or comment on a pic that I put on Instagram and say, yep, that's my nose. I'm so glad you did it. Whereas
Yep.
others just don't want anyone else to know. I think with body surgery, people are a little bit more open about it, especially breast augmentation. But even with body, even though I don't do a lot, even with mums having tummy tucks, for example, it's taboo as well. It's like, why did you do that to yourself? It's a beautiful thing having a baby. You should keep the
The natural.
in their natural body kind of collateral damage from a baby, because it is a beautiful thing. Of course it's a beautiful thing, but you've got the baby as well. And ultimately
Yeah.
it's the mother's choice. I mean, as plastic surgeons, we don't go out to a market and a billboard and say, come and have a tummy tuck or come and have a facelift. Like people
Yeah.
see us to
You're
do
not
something.
standing outside the
Yeah.
preschool
So
going, come
people come to
on.
us for their own confidence. We don't go out there asking for it. So
Yeah.
obviously we have an image in society, and we market just for those
Mm,
patients that are looking for that service, but we don't go and seek people to do it. So, but yeah,
yeah.
unfortunately, it's very taboo. It's like, and that's part of the problem with the roller coaster journey, because you need emotional support when you have plastic surgery.
Mm,
A lot of, especially my facelift patients, they just don't have that because they keep it so secretive. So in the first 2 or 3 weeks, we're their emotional support. Like they come to our clinic multiple times a week, and we're the ones on the other end of the phone all the time because they just don't want to talk to someone else. Like I've had many patients that, for example, would just stay in a hotel for a week.
Wow.
Live in Sydney, and they just don't want to go home while they're recovering.
One thing, so you specialize in sort of facelift, your eyelids, and the rhinoplasty. Now, I'm totally addicted to watching your Instagram, and sometimes, like, I'm flicking through it first thing in the morning, like, oh, crap, I wasn't prepared for the surgery part.
You know, sometimes
But
I throw one in every now and then.
yeah, and I'll be like, first thing in the morning, oh, good. But I always find what you do in the eye area is
Yeah.
amazing because so many people they age so much through here and they have like all that excess skin and it just blows my mind. Is that procedure like how painful is something like that?
Yeah, great question. Like, what happens is you have discomfort for probably the first 2 days afterwards.
Okay.
And you know, my anaesthetist prescribes all the pain relief, and you're actually quite good. After 2 or 3 days, you're just needing Panadol, and that's it. So it's not as painful as you think. What happens is your eyes are quite dry after surgery and a little bit blurry because we use a lot of eye drops. Because you can imagine surgical light in your eye while we're operating, so they tend to dry out a lot. So we recommend eye drops before surgery and after. And for that reason, the eye drops we use moisten the eyes so much that you get a bit of blurred vision. So apart from a bit of blurred vision and discomfort, it's actually not that painful.
Wow. Isn't it funny? Because you just think the eye's sensitive,
Yeah,
but the fact that the pain's done in 2 days, that's better than wisdom teeth.
totally.
And yeah, much better looking after it as well. What would
You'll still be bruised for a good week to 2 weeks, but
yeah,
then you look amazing. Yeah.
yeah, after that. Yeah, I
Yeah.
just find those results really give people back that youthful appearance.
Yeah,
I
100%
find.
agree. Like if there's one operation that's relatively straightforward on the face for anti-aging, it's eyelid surgery.
Jack, what would you say, like throughout people's ages, what's the most common surgery, say for people with 30s, 40s, 50s, 60s, like in each demographic?
Look, I would say probably if you're looking at 30s, you're probably looking at for the face, it's more rhinoplasty surgery.
Yeah.
40s is the same thing, rhinoplasty surgery. In the 40s, you'd start getting people asking for a mini lift or a short scar facelift or a ponytail lift.
So what's a ponytail lift? What have I been missing out on?
Well, ponytail lift is it's a new buzzword, but it's not that new really. It's basically what you're doing with a ponytail lift is you're lifting the upper part of the face. So
Ah,
face lift often lifts this part, so you're lifting the upper part. So you're lifting the eyebrow, and the cheekbone through an incision in the hairline, and it creates the effect as if your hair was in a ponytail to pull the upper part of your face.
oh wow. So that's so the short scar or the lower would
Yeah,
do, if you're not ready for the full facelift, that's
yeah.
where you can actually,
Tailor it. Yeah. So the
wow.
ponytail is more for the upper. It's basically like a brow lift with pushing a little bit more on a cheek, whereas the
Yep.
short scar is more for the lower face.
Yes,
And obviously, if
I've
you're doing
seen those ones.
yeah, I know you love those ones.
I love them. I can't I comment because I find for me, because we do get it, like we do a Botox through
Yeah.
here, and that's kind of enough for me through there. But I
Yep.
do like see when you do this, like how much
Yeah.
that just sort of really gives people that youthful. And
Yeah, it does. Yeah.
how do you do that neck lift? Because like
Yeah.
I
Well,
stand there in
with
front
the
of the mirror
short,
doing this,
with the
I
facelift,
do it with my
you
granny.
have a muscle here. You have a
Yeah.
muscle that kind of blends this way called the platysma. And when
Yep.
you're doing the short scar, what you're doing is you're opening the muscle here and you're suturing the muscle to the back of the scalp like a hammock. And that's why you're tightening the neck. When you're doing
Ah.
a formal neck lift, like in an older person that's got a double chin or very loose skin, then you're making an incision here and also tightening the muscle like a double-breasted suit in the front as well.
Oh
Then
wow.
you're removing the excess skin. But as part of a short scar mini lift, then you're just tightening it from the side.
So, and I know this might sound a bit silly, but if you were to do sort of like a short scar or a ponytail, like you get to, that could get you through your 50s and, looking great.
Yeah.
And then if you got to the 60s or 70s and you thought, okay, I want to kind of do a bit
Yeah.
more, can you move into?
Yeah, you can. Like absolutely. Like as you were asking before, like in your 30s, 40s, 50s, you can do short scar or ponytail or a combination of both.
Yeah.
You can do a short scar facelift every 7 or 10 years. When I was in New York working with a guy called Cheryl Aston who did Audrey Hepburn's facelift, we operated on someone who was 65 and she looked like she was 39 or something. And he had just basically lifted her face like mini lifts every 7 years. She used to fly in from, I can't remember, she was from either like Florida or North Carolina. She used to fly in and just get like a little short scar lift every 7 years. And he'd operated on her like multiple times. So you can do it that way. You can just do little lifts as you go, or you could just have at the same time, I've done a full face and neck lift on someone as young as 46 as well.
Really? But were they aged quite heavily for their age?
Yeah,
Or
they
not?
were aged heavily for their age. And part of the reason was they were pretty much a fitness fanatic. So they lost a lot of their facial volume and they had a lot of skeletal facial aging. So the best thing was to lift everything. But as you say, when you're 50, 60, then it's probably better to do a full face neck lift. You just get a better result. But a lot of my patients don't want the downtime or don't want the investment to do a full face neck lift, even when they're 60. So you still can do a mini lift and they still look quite good. You still get a good result.
And then let's talk about Artiste, which is your your baby,
Yeah.
basically. So tell me, when did you think it was the right time to sort of say, okay, I'm ready to go out. This is my business
Yeah.
and this is us.
Yeah, I guess it was like even from a child, like I was talking about before, I was growing up pretending I was going to my own clinic. So I didn't think of it as a business, but I thought, I wanted to have my own clinic. I wanted to work for myself. And I guess having like almost 18, 19 years, whatever it is, in the system of, training as a doctor, working in hospitals, working for other people. And finally, when I went to New York for my fellowship in face plastic surgery, it was finally I had the time to just relax and just kind of just be my own thoughts, and no longer I had to answer to anyone. Like I was there learning how to do things, but I didn't have to really answer to anyone. I was kind of, reflective on where I've got in life. And I was like, wow, I'm 34 now. This was back in 2013, or I was turning 35. And I was like, wow, I can't believe it's been 35. What's the next step now? I've done all my exams. I'm a plastic surgeon. I'm learning how to do facelifts. What's next? And it was like, I had job offers to come and join other clinics while I was away. And I was like, no, I can't. I've always wanted to do my own brand and business. I just deep dived into it. And while I was overseas in Paris and New York, I wrote content for my website, and the name Artiste, I wanted to choose a name that wasn't my name because I saw it as something bigger, because I'm looking, for other doctors to work with me. And if I called it Dr. Jack Zoumaras, like, my ego is not that big. It doesn't need to be called me, So I wanted to name it a name that could go anywhere. And I guess the name Artiste stuck because it was elegant, sophisticated. It's the French word for artist. And in plastic surgery, that's what you're doing. You're sculpting something, you're creating something. So that's how the name Artiste happened. So Artiste Plastic Surgery.
Yeah. Oh, I love it. And then, so what key messaging, like when you were building your brand, and obviously, you'd been working in your industry. So when building your brand, what were the key messages behind your brand when you're building it that did you want to make sure that people, were synonymous with your brand?
Yeah. Well, in the beginning, I guess it was more just communicating the fact that I was a plastic surgeon who had specific training in facelifts from New York and Paris. So that was all the messaging. In terms of like having the brand or having the business, as a doctor, I had no idea about business, no idea about actual branding. So it was kind of just going into it, and all of a sudden, you've got a receptionist to pay, you've got fit out to pay out, and you just don't think about those things. But I guess that's what makes it kind of exciting as well. You just follow your passion. So you learn like really quickly how to run a business or over 2 years by making a lot of mistakes. But I guess the branding now is all about elegance, sophistication, minimalistic if you want it minimalistic, but less is more, like creating like great results with getting people wondering if you've had surgery or not. So the branding now is just all high end, elegant, sophistication, and to stand out in a right way, not in a wrong way.
Yeah. You sort of touched on something, and I think this crosses to so many people that do follow me across my socials as well, is that there are a lot of creatives and a lot of people that have a craft, and they're extremely good at that craft, whether they're makeup artists, hairstylists, or someone that works in beauty, or, performers. But then all of a sudden you have your own business.
Exactly.
And like what you said, you don't have those skills until you need them. Did you then start getting into it and think, holy crap, I now need to go and understand how this functions and to be able to be successful in business and at your craft?
Yeah, 100%. Well, you kind of like look at it, and for me, the turning point was all of a sudden thinking, I'm spending all this money on marketing and people doing some advertising for you or some branding or brochure development, and I'm not getting a return on investment. And then you break down your numbers and you're thinking, I'm not doing that well. What's going on? I thought plastic surgeons made money. You know what I mean? Like, not that you do it for those reasons, but then you think to yourself, okay, let's read some books and work out how to work things. And then you just begin to realize that, you know what, you're not good at marketing or you're not good at that. Let's get someone that's good at it. And sometimes, unfortunately, as doctors, we fall for that. I'm a medical specialist marketing person. But what that means is I'm going to charge you 10 times the amount and deliver 10 times less the results, unfortunately. So you just got to educate yourself as a business owner. And you can still be like, for example, like I've had other plastic surgeons work for me and work part-time, but I'm still the sole person who's doing the craft. But then I've got other people doing other aspects of the business that are better than me at business. But you just got to have enough understanding to be able to manage it.
Yeah.
So you're not getting ripped off and know where the business is going. So, basically almost like doing a mini MBA, I guess, for your own business.
Yeah. I think, how many years or what did you say you studied to be a plastic surgeon?
Yeah, like 19 years or 8. Yeah, I think so. 8, 9, 17 years. Yeah, too long.
Yeah.
Too long.
And then, but to do all of that and to know how much work you've got to be putting in
Yeah.
to be a specialist. And then people like us will go into opening a business and just go, oh, okay,
Yeah, no,
without
exactly,
having
yeah.
that skill. But, you do learn along the way, but
You do, yeah.
you're constantly learning to
Yeah,
evolve.
100%. You're constantly learning. And obviously, these current circumstances we're in throws another spanner in the works. And you just got to get set up in terms of what to do and what you're doing. So, yeah, you got to continue to evolve and continue to learn. And the one thing is you just got to, I guess the biggest thing, if I would give advice to myself 5 years ago, is just to learn from people that, and I think I've got this advice from someone else, is good, get business advice from someone that's probably a little bit higher in terms of your business. So don't take advice from people whose business is smaller than yours, like whose business is a little bit higher and has been through it with you, so they can offer good advice. Because whilst I learned a lot, I also wasted a lot of money by learning, whereas I could have actually learned and invested in myself to learn, which I have done, but
Yeah.
I've learned the hard way. And this is why I like helping my fellow doctors in terms of what they're doing with SEO and things. Like a lot of the times they call me, and a colleague of mine, Johnny, who's called me and asked,
Yes.
how much should I spend on SEO, or should I do Google AdWords here? And even with other, and I go, no, they're ripping you off doing that, or these are the questions to ask. So it's good. I like to give that, because I don't want people to get ripped off. And in business, it's hard enough as it is. You don't want to get ripped off. So it's important to stand by your own philosophy, your brand, and work your business properly as well.
Yeah, I think that's very good advice. Now, you did kind of just sort of say you made a few mistakes in the beginning.
Yeah.
Is there a mistake or anything that you'd be happy to sort of, or a mistake that you'd sort of be happy to sort of chat about that could potentially stop someone else from going through the same thing, or tell me something that you learnt that. So I guess learning from the success and failure, so to speak.
Yeah. I guess it's hard to say. I guess probably what I would have done is, in the beginning, I probably would have done a little bit more business reading before setting up. And what I mean by that, even just negotiating your lease, things like that. Don't sign any contracts, don't sign any heads of agreement, work out what you're entitled to set up a space. But probably in the beginning, and we've got the advantage of doing it now, is before deep diving into getting a space, is you can probably sublease something in the beginning. Who knows what's going to happen with COVID now, but there's a lot of, renter spaces for work. It's a little bit difficult in the medical space, but there's a lot of medical clinics where you can rent a room, for example. So you can run your business out of that until you get an idea of how what's working, what's not working, before, making the big decision about getting your own premises and fitting it out. Because that's obviously ties up a lot of capital and things. So I would say that's probably good advice. Just take your time with setting it up. And also dream big. I think it's good to dream big in the beginning. Your dreams always change as well, but there's nothing wrong with dreaming big, and just work out how to get there, I guess.
Yeah. What would you say the best advice is that you've ever been given, whether it's business or within your craft?
Oh yeah, good question. I think in terms of with my craft plastic surgery, it's especially when we're training as a plastic surgeon, is treat every operation you do with the utmost respect, even if it's something as simple as injecting Botox or taking a skin cancer out. Treat it as if you're doing a facelift on anyone, and that way your standard is very high. That's probably the one advice in my craft. the other advice in my craft, which I think is a really good one, is also to train the people under you to be better than you. And then that way you're leaving your craft always, it's going to go up. Do you know what I mean? Because you're training people to be better than you. So therefore, so just going to escalate. So that's what I would say from a craft point of view. From a business point of view, I would say, I'm just trying to think. From a business point of view, you probably would be surround yourself with good people. Like, you know, you learn, and as your business grows, you need to change people. So you need to just keep employing your A people. Your A people might be different when you start your business compared to 3 years' time. And that's what I was saying before in terms of like try and get advice from people that are at a stage of business ahead of you and have been through what you're going through, because they can offer real salient advice.
Yeah, I think that's, very good advice. What do you do to sort of give back to the community? Like you just mentioned education.
Yeah.
Is that something that you are really strong? Like,
You know, I love doing it. Like I love teaching. And it's good because it reminds me of when I was younger, who was being taught by plastic surgeons or other doctors, and I really resonated with them. And even today, I've got so much respect for them. And sometimes you can see people that were like you when you were younger, and it's kind of exciting as well. And you can see people that are really super keen, and I like that interaction because it's you give them confidence, because a lot of the time it's not just medicine in society. We like knocking people down. It's like, oh, you've got a long way to go, lass. Because I got a lot of that as well, wanting to be a plastic surgeon or a doctor. I was like, oh, you might not become a doctor. You might not become a plastic surgeon. There's a lot of like knocking on the head. Oh, you might not do this. A lot of negativity. So it's good to like then come across someone who encourages you to do it. So I like giving that encouragement back, because we're human beings. We're capable of anything.
That's right.
And everyone is capable of anything they want once you put your mind to it and focus. So I love teaching. So I'm in terms of like formal teaching qualifications, I'm like senior lecturer at University of Sydney in Wollongong. So all that means is I do usually once or twice a year, I do examinations for the University of Sydney, and I have people follow me from the University of Wollongong. So they come and do an internship with me at least once a year. So I teach that from that's like an actual structured teaching. And then of course, like anecdotally, like I teach medical students all the time. They come and watch me operate, nursing staff as well. As I said, I was involved in pilot studies in plastic surgery just to advance our specialty in general in terms of diagnosing psychology and mental health issues in plastic surgery patients. So from that point of view, I've given back. Obviously, research is important. You can see the importance of scientific research. Like I present at national, international conferences, because the one thing in plastic surgery is every time I do an operation, believe it or not, I've never been 100% happy with any operation I've done. I always reflect back and look back and go, I could have done better there. I could have done better, because you just always want to push yourself to do the perfect operation. You know what I mean? So you just got to reflect and criticize yourself to get better. And so it's always self-reflection. And that's what research is important, and presenting on an international stage. So I've always wanted. And the other exciting thing I'm doing, Mel, which I haven't really told anyone, is I'm actually writing a book now.
Oh, I love it.
On my journey. I haven't named it yet. I haven't got a title yet, but it's basically my journey from a youngster to a plastic surgeon, and then a little bit about the history of why people get facelifts and why people get plastic surgery.
Oh, I love that. I look forward to reading that. You have to make sure we let it know when we're out. We'll put it up on the website. I think it's a nice way to see it, because you see it from, a doctor's point of view, whereas, as, friends and things, I might chat with like women and things about different little bits that I might want to get done. I'm definitely not shy about it. And,
You're not shy, which is good. But it's funny you say that, because if I'm at a party or at a social gathering, people are quite happy to come and chat to me in a group about plastic surgery, what you do. But as soon as it comes to a point where they're actually seriously considering doing it, then they don't want to talk about it to anyone, which is really interesting.
Yeah, I still find that really... Yeah, I think I probably talk too much in general, but hence why we're doing an interview series.
That's why we're doing an interview, Who knows, in 20 years' time, Mel, we might be doing your facelift live on Zoom.
20 years? I'm not waiting that long.
You're great, Mel.
I'm ready for the short skirt. I used to always do this with my grandma. We used to stand there in the mirror and pull our faces back. Well, she used to do it a whole lot more than I did, but she's like, imagine this. And I've never stopped doing that, as silly as it sounds. Jack, this has been amazing and really insightful. Just one more thing. Can I ask, you're the chairman of the Australian Society of Plastic Surgeons as well?
Yeah, the New South Wales division,
Underachiever. But can I just say, is there one thing that you find people sort of have a common fear about plastic surgery? Is that because some like you've heard so many bad things in the
Yeah.
media, and is that why it's
Yeah.
important for you to be on a board that represents the quality of surgeons? Is that?
Yeah, it's that as well. It's also to provide balance to because in plastic surgery, like there's people doing cosmetic aesthetic surgery, which I do the majority of. There's there's reconstructive craniofacial surgery, hand surgery, cancer surgery. So it's good. So I'm basically providing the aesthetic balance to that society.
Yeah.
Um, and it's also, like you said, as a public advocacy, it's important for people to know that a lot of not all clinics are equal. So not everyone doing cosmetic surgery is a plastic surgeon, which is a gold standard. So just to provide that education and safety for the community.
If like for people who weren't aware,
Yeah.
like like I come to you just for Botox
Yeah.
because for me that's important. This is my
Yeah.
face. So I care about who does that, and I would prefer to pay someone with your level of experience to
Yeah.
ensure that I get it right. But what would people be looking for if they either wanted to go further than Botox and things
Yeah.
like that? What are they looking for when they look for a good plastic surgeon? Like what
Well, I guess
qualifications?
they're looking for someone like you have got to have FRACS by your name, which means you're a fellow of the Royal Australian College of Surgeons, which guarantees your minimum 17 years of study and qualification. And then outside of that, if you're looking for plastic surgery, you've got to be a plastic surgeon, obviously. There's other surgeons that do some plastic surgery operations like breast surgery, breast surgeons, ENT surgeons do rhinoplasty and some facelifts, but a plastic surgeon is the only one that's trained in aesthetics with principles. But then you've got to look further than that and say, okay, so what sort of procedure does my plastic surgeon do? And have they gone overseas to perfect their technique? And obviously
Mm,
look at their before and after gallery as well, because the standard in Australia is really high. So as long as you choose a plastic surgeon, then the standard's high. But then you've got to choose, okay, what sort of plastic surgeon is going to be best for me? So obviously, doing a rhinoplasty or a facelift or eyelid surgery is totally my domain. Just like if you're going, you're just going to it's hard for me to put it, I don't want to minimize the importance of it. But for example, if you're going to go to a tire shop for your car, you're going to get tires there. You're not going to get something for your engine, for example, So even though the
yeah.
mechanic might know about engines, like it's that sort of thing, just that subspecialization to just
Yeah.
make sure you're going to a specialist.
Yeah. And so I guess doing your research, like
Yeah.
really do your research
Do your
and
research, look at before and after gallery, look at reviews,
yeah.
and also just attend consultations. Like often I recommend patients attend more than one consultation, see two different doctors, and things
Yeah.
like that.
Is it important as well for somebody if they were considering surgery that they feel like that they can communicate and be really comfortable with the
Yeah,
person doing the
100%.
surgery?
And you have to, because as a doctor, sometimes it's a pride thing, but I can sometimes sense when a patient wants to tell me something, but they might be too embarrassed to tell me. And you've got to have you just got to have the humility as a surgeon, especially when I first started my practice, like, oh, you're not quite happy with that, or just be honest with you. I'm happy to revise it for you, for example, because at the end of the day, medicine is not black and white, it's gray. So sometimes you need to do something twice. Like the revision rate's quite low. It's like under 5%, but you've got to have the humility as a doctor to say, okay, you're not quite happy with your result. Let's do it until you're happy. Just like if you
Yeah.
to someone to put a new kitchen in your kitchen, you're not happy with it, you tell the builder to redo it or whatever.
Yeah.
It's the
Give me a
same sort of
tweak.
you just give it a little tweak, and there's nothing wrong with that. So if you haven't got a rapport with the surgeon to do that, and unfortunately a lot of doctors lack personal communication skills because they're so just smart in what they do,
Yeah.
and they haven't got that rapport with someone. So you've got to be comfortable with someone who's operating on you as well.
Yeah, 100% agree. Yeah, it's that comfort factor and
Yeah.
everything I think needs to come together. So,
And
yeah.
that's why one of our values in artistic plastic surgery is we're basically going to keep going until you're happy as the patient. Do you know?
Yeah. Yeah, I think that's a nice thing. Like, at the end of the day, the client's your priority and
100%.
achieving the right result,
Yeah, that's right.
works for everybody.
Yeah,
Cool. This has been amazing. There's lots of food for thought, and I'm just going to go and
totally.
do this in the mirror just for fun for a bit longer.
I don't know why not.
I know, but now I don't think I need that. I just need
No, you
that.
don't need that. Yeah, yeah.
Yeah, never boring in my world. I think in the last couple of months, yeah, actually, the amount of people I've spoken to who've actually contacted me and asked me for even skincare advice
Yeah, yeah.
because everyone's been at home staring at themselves in the mirror for too long.
Looking
And
at
I've
the
had
moon.
so many people say, "Oh, can you
Yeah,
give me some advice on some good skincare? Can you give me some advice on this?" Or,
totally.
because they're starting just to feel it. Whereas I think when you're so busy at work and you're going from one thing to another all the time,
So
you
true.
don't
Yeah.
see it as much. But a few people have had sort of been, and then I've been doing the same thing as well. Actually thought my natural blonde was coming through and it wasn't grey for about 2 days. Oh God. Jack Zoumaras, thank you so much for joining us on Brilliant Brains and Beautiful Minds.
My pleasure, Mel. It's been a pleasure to talk to you, and so happy that you invited me on. It's been fun.
Oh, thank you. And thanks for just being honest with us about, your business and also, yeah, like what people need to look for. It's
Yeah,
just really
100%,
important.
100%.
Head on over to beautybossbusiness.com for all the links from today's episode. Thanks for joining us on Brilliant Brains and Beautiful Minds. Until next time.